this is a pleasure, too. Discovery Week going on at Woodstock Hospital. This happens every year where med students come in from Western University, and I think there's 12 of them in total. We've got 2 in studio. We've got Joey and Jessica. Good morning.
Good morning.
Thanks for joining us. How exciting has this week been for you guys here in the Friendly City?
It's been awesome.
Yeah, it's been amazing. Thanks for having us.
Yeah, and you're first-year med students.
Yeah, we just finished.
One of the things that we always like to ask is, what was your inspiration for getting into medicine? Joey, let's start with you. I wonder, somebody in your family in medicine? That's always the question I have. Is what about for you, Joy?
Yeah, so none of my family is in medicine, actually. But the reason I first started on this path was because, well, my parents told me to. So I was just kind of blindly following this path for a while until in August of 2021, I myself got really, really sick. I went into septic shock, and I was brought into the emergency department, and I went to a community hospital, actually. And I was admitted into the ICU for 8 days. I was really sick. I was about to die. But you know what? I met this amazing doctor who just worked so hard to save my life, and I could tell he just would not let me die.
Wow.
And the staff there were just so amazing. They knitted me slippers because I couldn't fit into the hospital shoes. Aww. And the doctor, I could hear him calling up his buddies from med school. He spent so much time chit-chatting with me, and I was just so touched by his humanity and his intelligence that I was like, you know what? If I'm already on this path, and now I understand why.
Yeah. Oh, wow. That's a great story. And what about for you, Jessica?
It's a lot of the volunteer and employment experience that I had. I used to volunteer for Kids Help Phone, and I worked with the city of Hamilton connecting youth to mental health resources. And a lot of that work was really, really fulfilling, but I got to see the social side of things, and I got to hear about a lot of these youth who really could find the best help if they got to seek psychiatric help, or if they had doctors to kind of help them, I guess, navigate the system.
Yeah.
And I wanted to be able to be that person, because from the position that I was in beforehand, I really didn't have that much ability to help just being a volunteer. So I wanted to go into a position where I could be the person to offer that help and that support.
Wonderful.
Yeah, that's awesome. So for Discovery Week, you guys have been shadowing doctors over at the Woodstock Hospital. Amazing opportunity. What's been your favorite part so far?
A highlight. Yeah, for you. Who wants to go first?
I'll
go ahead,
I'll go
Joy.
first then. So this is my first time being in an operating room. I haven't seen anything surgical yet. And I never really considered it, I always thought I was more of a medicine girl over surgery. But it's just been such a fantastic experience. The doctors here are so excited to teach, and they're so nice. And I remember shadowing, on my first day, I was shadowing this orthopedic doctor, and he was so nice to me. But you know what? He was asking me a lot of questions. Oh. And I'm not going to lie, we haven't learned about the bones yet. And no, you know what? I told him, doctor, my knowledge ends at my shoulders and my hips. And he was doing knee replacements. And he asked me, so Josephine, what are the 3 bones of the knee? And I was like, 3? And I'm like, you mean the knee bone? And I knew nothing, but he was so nice, and I learned so much.
So what are the 3 bones of the knee?
Do you know now? Do you know
I know it now. It's the femur, the patella, and the tibia.
Perfect.
There you go.
And what about for you, Jessica?
I think the highlight was getting to see the different parts of psychiatry. So I've done some observerships, so getting to shadow doctors at the London hospitals. And because there's so many psychiatrists in those big academic centers, it's really siloed off. So you're either doing a very small portion of psychiatry or a different small portion of psychiatry. So getting to see the stuff in this hospital was really cool, because these psychiatrists get to do everything in psychiatry. So they're seeing patients who are living in the hospital with more acute, more serious mental health conditions. They're seeing patients who maybe are less severe but have still appointments with doctors in the hospitals. And she gets to go to the emergency room and see people who are coming in for psych-related behaviors and kind of determine where they're going in the hospital and what their, time in healthcare is going to look like. So it's been really cool to get to see, every side of psychiatry and every side of all of the specialties that we've gotten to see.
Something you kind of mentioned to us off the air was that coming to a smaller hospital like in Woodstock in London, they're expecting to have students in, but this doesn't happen for the doctors here, and they're pretty excited to share their knowledge too, right?
Yeah, they're always so passionate. I got to speak with an anesthesiologist yesterday in an operating room, and while he taught me about anesthesia and all the stuff that goes along with that, he was also telling me a lot about how healthcare runs and the politics of healthcare. So it's really interesting to learn about, but also it's kind of scary. We probably should know this stuff now.
They don't teach you that in med school.
They don't want you to know that because they want you to graduate and continue on. We've got Joey and Jessica in studio today. They're a couple of med students from Western University, part of Discovery Week at Woodstock Hospital. Was there something that you have seen at this point, Joey, that does it make you quiver or queasy? You've seen a couple of surgeries, anything like that you can share with us?
Yeah, so like I said, this is my first time seeing surgeries, and I've actually been totally fine. I thought I would get a little queasy with like the blood and everything, but no, everything's fine. But you know what? I did see this doctor remove a fungal toenail, and that's what got me. That's my limit.
It got Marcy too.
Yeah,
she didn't even have to see it. She heard you talking about it.
Another
necrotizing flesh, totally fine. Blood gushing, that's okay. But removing a toenail, that's where I draw the line.
The only reason why I reacted like that is because years ago my brother had to get his big toenail removed. It wasn't because of fungus or anything. It was just like a really bad ingrown toenail, and he was trying to like show us the operating video, and I'm like, no.
So something about the nails, that doesn't settle right.
And the feet.
Yeah. Feet and nails there's nothing great about that anyway. Jessica, what about for you?
I'm still a bit queasy watching doctors use scalpels and doing the suturing. I don't know, seeing the patient's skin get cut into like that is a bit hard for me, but I'm sure after a few more experiences watching that, I'll be okay. But right now, it's a bit nerve-wracking.
do either of you know what medicine you'd like to practice at the end? I didn't ask you off air, but Joey, have you got thoughts yet, or are you still open?
I'm super open. Coming in because of my experience at the hospital, I thought I wanted to do like emergency or ICU stuff, but I'm really, really open to anything.
To anything at this point.
Except for maybe the feet.
She'll get over that. And what about you, Jessica?
I think I gave it away with how much I talked about psychiatry, but I'm quite interested in psychiatry.
Yeah, that certainly sounds... it's something that certainly could be very helpful in our world today. Yeah,
I hope so. That's something I'd like to do. And again, I'm not too great with the blood stuff, so psychiatry is kind of the only option.
Do you guys get when you're involved in medicine? It's very hardcore. I picture being in books, maybe not books, but online and learning all the time. Do you have time for other stuff? Do you have hobbies that you?
How do you unplug?
Yeah. What about you, Joey? Do you have things you enjoy?
Absolutely. We get a lot of time to, explore our hobbies, explore our interests and everything. I really love running. So nice. I'm training for the Toronto Marathon.
Oh, good.
And I have more than enough time to do that. It's all about time management.
Yeah. And what about you, Jessica?
Yeah, I think there are a ton of time for hobbies. We've got opportunities to join clubs and I guess even make our own clubs. Like one of my friends is starting this Glamour Girls Club, so we get to go to like long-term care homes and paint people's nails and do stuff to kind of make people there feel a little bit more included and stuff like that. But yeah, hobby-wise, there's time to like read, watch TV, and relax, which is, thank goodness.
It's probably encouraged, I'm guessing, too.
Yes, for sure.
Yeah, to try and unplug.
So now that you guys have wrapped up Discovery Week here in Woodstock, do you guys think you would consider ever working for a hospital or just in a small community like ours?
Oh, for sure.
Absolutely. It's amazing.
Yeah. You got a chance to meet my doctor, Dr. Davies, as well, who was part of Discovery Week. I want to say 2018, but forgive me, I might be wrong on that. And she's a wonderful person. You got a chance to chat with her.
Yeah, I shadowed with her the other day, actually. Yeah. It was fantastic. She loves her job, and I can tell. And she's so on the ball. All the patients love her, and I can see why.
Yeah, absolutely.
The CEO was telling us a lot about her, and I think that's one of the success stories, right? We're coming out to these rural communities so that way we can come practice here once we're done our education. And honestly, the hospital seems like such a good community. Like all the staff members know each other and everyone is just so warm and inviting. It's hard to not want to come back.
Yeah, it's a state-of-the-art facility because it's still fairly new. It opened in 2011, but if you ever saw the old hospital, you would know how much more state-of-the-art and how much more functional this new hospital is. So we're very lucky to have it. It was great meeting you guys today, Joey and Jessica. Before we let you go, anything else you want to pass along to the community? It may be in regard to your education this week or anything else that you'd like to share with us.
I just want to thank any patients that I've already seen for letting me observe. thank you so much for participating in my education. It really means a lot.
Absolutely.
I want to resound that sentiment. And also, if you're someone who wants to go into medicine, it's definitely a hard path, but it's so worth it. So you may face a couple rejections along the way, but it's definitely worth it to keep going, because if you want to do this, there's a place for you.
Yeah. And Marcy and I often talk about this. Your doctor is Dr.
Yu.
Dr. Yu, and I've got Dr. Davies, obviously. And a lot of people don't have family doctors in their home community. We're pretty lucky, but just want to thank you for getting into medicine, and your colleagues as well, all 12 of you. And I think there's like, what did you tell me, 150 to 190 in your program across Western and in Windsor. So yeah, thank you for getting into medicine, because you really need it, and very coveted in communities. Thank you so much for doing that.
Oh my God,
Thank you so much for having
Thanks for having us.
It was great to meet you guys. Thanks for coming in. It is 8:19.
Are you tired of looking?